Sir, shall we start? A very warm and a pleasant evening to everyone present here today. I, Gunjan Rajput, on behalf of We Citizen Foundation and sarkarischool.in, welcome you all to this event called the COVID Talk. December 1, 2019, the first case of COVID-19 was found in Wuhan, China. And by 13th March 2020, the COVID was spread around 100 to 22 countries in the world. The coronavirus was described as a devastating blow to the entire planet. Some decades from now, the future of this country will be asking and learning about the coronavirus to help them and to guide them. Sarkarischool.in present the COVID-19 talk with one of the most honorable scientists, Dr. Amita Kumari. We welcome you, ma'am.
Thank you. Thank you so much.
Let's begin our session by welcoming Mrinali to tell us about Sarkari School. Over to you, Mrinali.
Thank you, Gunjan. Someone has rightly said that it's nice to be important, but it's more important to be nice. SarkariSchool.in is an initiative of the We Citizens Foundation. We took an initiative to build a platform for those working in the field of school education, uplifting the future of younger generations through their hard work. We are also featuring those people who never cared to put pictures on social media and use them to drag around making an image of the great social worker. Our main focus is on imparting education to children who will stand up to be successful citizens in the near future. This is one such platform where we organize conferences and meetings to keep spreading the good deed through our channel. Upliftment is what we seek, and this is possible only when we all come together to do our bit. Over to you, Gunjan.
Thank you so much, Mrinali. Now I would like to invite Pooja, our project leader, to tell us about Project Arogya. Over to you, Pooja.
Good evening, guys. Am I audible?
Yes, Pooja.
Yes.
Good evening, everyone. I'm Pooja Patil, project lead. Project Arogya is Project Arogya is a unique effort by SarkariSchool.in. It aims in spreading awareness about health and different health disorders among children. I have seen a lot of people lose their lives and their loved ones due to mental health ill-related issues, which could have been either detected early or rectified by adapting healthy approach towards lifestyle. Our aim is spread awareness and sensitize children and schools about their role towards a healthy lifestyle and ways to contribute towards society through health. We want to create awareness, as much as awareness as possible, to reduce the stigma which runs around different diseases through our various activities and initiatives. We believe that children are the future of our generation and a symbol of our health.
Thank you so much, Pooja. And now I like to introduce our esteemed guest of today, Dr. Amita Kumari. She has completed her master's in chemistry and from Ph.D. and from CCC University Meerut. She is also working as a woman scientist under the flagship program of Technology Information Forecasting and Assessment Counseling (DTC) DST New Delhi in the field of intellectual property rights since 2019. She is associate with the research and development since 2009. She has received 2 national and 1 international award for contribution in RD, and she has received CSIR Diamond Jubilee Award in 2009 and 1 International Researcher Award 2021. She has worked with the eminent scientists from CSIR, ICMR, an Indian Pharmaceutical Commission. She has contributed in more than 60 books of CDT standards. She has also presented various lectures in the field of chemistry. She is an active reviewer in 3 international national journals and has published more than 20 international national researcher articles, book chapters, single drug monograph, and books. We welcome you, ma'am. We are so delighted to have you with us. With your permission, shall we begin today's session?
Thank you so much, Gunjan. And first of all, I would like to thank all the members present here and audience. Thank you so much for giving me this opportunity to have a talk on COVID-19, and thank you for briefing me well. So we can start our conversation.
Sure, ma'am. Ma'am, I believe it's correct to say that COVID had took many lives in the past
Yes,
1 year, 1.5 year, and the physical side effects have already harmed our physical health. But also, our emotional and the mental health is somehow also disturbed due to COVID. And there is this talk in the world that the third wave of COVID is still being discussed. And also, I believe in some state the third wave is already there. So, if you have to put in like a simple word for a viewer, so what exactly is this third wave of COVID?
actually, as we know, the virus has high mutation. Therefore, there are some mutation in the virus, and due to mutation, it get different variant. We are getting different variants of the virus, and third wave is associated with the new mutation of virus, new mutant of virus, that is that Delta variant, and nothing else. It will be similar to the various earlier two waves. Just just as a new mutant of virus, that is third wave. Nothing else.
Is it like vulnerable to India?
Yes, of course, it can be. Because our earlier prediction about the second wave was that it would not affect much peoples because we are getting the immunity against the first virus, but all our prediction goes down regarding the second wave. It takes many lives, it harms lots of lives of people, and it become vulnerable. But as we can't say that, we can't predict actually what the virus will do in coming days. Therefore, we should be caution about the coming third wave.
Also, we are hearing this, ma'am, that children are likely to be most affected from third wave COVID-19. So, how true is this term in the scientific facts?
Actually, when they say children are affected mostly for COVID-19, however, it is not true because in terms of scientific fact, there are several data which depict that children are less affected by this virus. But in third wave, we are assuming that a number of people across India tested positive for the COVID, and now numbers of children contacting with the virus has also been increased. However, it has not seen that children have been affected in, or we get some increment in the cases affected by the COVID. But the new wave may affect because the peoples in India goes through this COVID-1 and COVID-2 virus attack, and entire household become infected with the virus, and more so than the first wave we get infected with the second wave. So it need to be caution and continue to be follow the COVID appropriate behavior strictly. Therefore, it is not an assumption that children may affected by this third wave. This may affect the children because now our house will become entirely infected with the virus. Although we get immunity from the first and second virus, but this may affect the children.
And we hear that new symptoms like more anxiety will be more virulent strain of virus.
No, it is not true because anxiety, the reason behind anxiety is moreover different from, there are several psychological impacts that people are losing their lives, losing their loved ones, they are losing their jobs, children are in home from last more than 1.5 years. So there is mood swings, and of course there is a behavioral changes in our adult as well as children. So anxiety may be a major reason affecting more people to the virus.
Okay. And like, what are exactly the symptoms expected for children or adults? Like, who will be affected more in the third wave? As we have saw in the second wave, there were like more, server effects than the first wave. So, what exactly could we accept that there will be something new in the third wave?
I think there is no any distinguished feature that the third wave will affect more. It is because we are psychologically weak now. Because
Hmm.
experience from the last COVID results that
Hmm.
there were so deaths, and there are several families who lose their loved ones. Therefore, there is a psychological impact on the society that the virus is harmful and it will take our life, it will take away our loved ones. So symptoms, if we talk about the symptoms of like high fever and
Hmm.
sore throats and headache, body ache. These are the general symptoms we have. We can't distinguish between the normal fever as well as COVID fever. Without test, we can't say that whether it is a COVID infection or it is a normal fever.
And there is a lot of preparing for the third wave. Like, everybody is now buckle up. Like, if there will be a third wave, they will have some measures and new hospitals are opening. But what is the special focus on children? Could you tell us like how we can prevent third wave on a ground level?
Look, the children with pre-existing major diseases like might be at risk, but normal children are will not be affected more, as per my observation, as per my calculation, because the severity of this diseases is vulnerable when we have pre-existing major diseases like heart related disease, kidney related diseases, and liver diseases and other diseases. The children, those are obese and those have obesity, and like they have diabetes, asthma, and chronic lung diseases like sickle cell diseases and immunosuppression diseases might having these types of symptoms in children, they may get a risk of this COVID-19 infection. And we should not be more worried about the children which are healthy. And as we have, I think our family members now have experience how to prevent COVID infection. We should
Hmm.
be caution about that, and we should take all the precautionary measures to avoid infection. Like if someone get infection in the family, we should stay away, and
Hmm.
we should isolate ourselves. Similarly, in case of children, if we think that child is infected with normal infection or COVID, like seasonal fever and other those things are also associated with the child's health. So, if someone think that children got infection with COVID, without test, not even a doctor can say that it is a COVID or a normal infection. So, we should take precautionary measures like provide, we should take precautionary measures like mm, we should maintain a proper hygiene, as we should take sorry, yes, we should take precautionary measures like healthy habits like washing hands properly and take rest, take proper diet, try to maintain calm and cool atmosphere at home, avoid junk foods. These we can do with child, and we can take other preventive measures like we should guide them, we should provide healthy foods to them, we should try to keep them calm. These we can provide them at the home ground.
Ma'am, you just said that we should, take healthy food, eat healthy food. So, like, can the virus be the cause of COVID-19? Can the virus be transmitted if we, consume the, cooked from food from like the Tetra Pak food or like foods like this, can this be like it won't be prevent, but can it be transferred the virus more if we eat outside more or we take the animal food?
Look, we actually infection spread at a larger scale now. So, in atmosphere, presence of virus has not been as much detected. But yes, the Tetra Pak we are talking about, Tetra Pak and other outside food, it may have infection outside the box. Virus may be stick over there, and without proper washing, if we are pouring that in tumbler, virus may stick in our fingers, and when we are touching anything in our home, definitely it will be transmitted from one place to another place. But yes, the children cannot be vector for spreading this virus, because we have seen that children are not much more prone to this virus, because overall data for infection of children from the world as well as from India, there are very less number of cases from the children. So infection from outside food is definitely there. It may spread from one place to another place, but children may not be the vector for this virus, and we should avoid outside food. We should take a healthy food from home, which we are cooking with proper washing and proper cooking, because outside outsider is taking preventive care is not mandatory. Even though if we are taking our uh, children at home, uh, uh, we should also take care of some precautionary measures, like we are taking vegetables from outside, we should wash them properly. We are taking out some packed food like milk and other necessary material, we should wash them properly with the uh, detergent, and we should pour that into the tumbler and another thing. And without proper cooking, and without taking precautionary measures when we are cooking the food, also may get um, point to spread this virus.
Okay. And like, what is your view on the vaccination of both adult and children's? Like, are there any new clinical trials that are conducted for children's?
Actually, vaccination, yes, vaccination is a one of preventive measure against the virus. But though we don't have suitable vaccine for children till date, yes, in adults, the earlier two variants, we can have prevention against those viruses with present vaccines. But the third wave variant, third Delta variant, is more dangerous, and those two earlier vaccines are not suitable for this present Delta variant. Therefore, if you're talking about how the vaccine is more, how the vaccine will be preventive for child and as well as adult, yes, it can be. But now the virus getting new and new mutation day by day. Therefore, we can't say that vaccine will provide us a suitable treatment for against this virus. Therefore, we should take preventive measures, like we should wear mask, proper mask, and we should maintain our hygiene as well as our social distancing, physical contacting with the people's infectious environment. Like if we are going outside, we should take care that we should not touch anywhere if not required. Therefore, vaccine, yes, vaccine is a treatment for against this virus, but till date we don't have any vaccine that could overcome all the variants of the virus. Or we have only option to prevent infection, to get infection from any way.
And this was like about the COVID third wave. I'm pretty sure our audience will be now, somehow more motivated how to fight with the third wave. And it's not like we all have this, fear in mind. The third wave will be more severe, but it only will be like if we happen to have third wave. Because if we, always are going out, then obviously the third wave will be here. But we already, started with the, precaution, then it won't be. So yeah. And ma'am, how to observe yourself if we are doubtful that we have COVID-19 exposure?
There are several preventive measures. The first step you should anybody should take care of COVID infection when they are infected with this virus. They should first of all they should isolate themselves. Don't be fearful that it will harm you a lot. It Yes, it will harm you a lot if you get time. If you avoiding your condition, it will may severely affect your health. But if you are taking preventive measures, like you are taking care of yourself, if you are taking steams and you are taking healthy food and you are isolating yourself, definitely after taking care of yourself you will definitely will overcome. If you get little infection of that, and if you take this infection for a longer time, if this exposure will remain you with a longer time, you are not taking care of first and 2 days, you are thinking that you get just running nose and sore throats, you definitely will hit by virus a lot. But if at the first step you are taking care of yourself, you are taking care of your temperature, you are measuring your temperature, you are taking healthy diet, you are taking steam and all the preventive measures in home, you are eating and taking proper care of yourself, like you can add zinc in your food, you can add
Hmm.
vitamin C in your food, and you are taking rest properly, you are entertaining yourself, then definitely little infection can be overcome within 7 to 8 days. But if severity increases, like oxygen level decreases
Hmm.
down, it may require to hospitalization. But in maximum cases, like younger and adults are not prone to uh, more by this infection.
Okay. And ma'am, can you just tell us like some healthy habits in COVID that we could just follow at like journal people could follow in their house, just some normal healthy habits.
Look, uh, yes, the healthy habits, we should always avoid the public places where crowd will be there, and we should always preventive at the first step. And first step for prevention is close your entry for the virus. There are only two entries and three entries for the virus, because we don't have data that virus will enter through the skin. It will
Hmm.
always enter through the mouth and nose, and moreover less with the eyes. So there are 3 points where the virus can attack and virus can enter in your body. So first measures anyone should take, that he should cover his nose and mouth properly whenever we are going outside. Okay. So at the first step, wearing of virus is, you know is more likely to avoid this virus, because we don't know how the vaccine is vaccine is giving us boosting power
Yeah,
for this
immunity. Yeah.
immunity booster. Yes, and it is more likely to avoid this infection by preventing the routes for entry of the virus. We should cover our mouth and nose properly.
Hmm.
We should avoid public places and interaction with the peoples. If we are interacting with some people, we should take a proper distance, we should maintain proper distance. We should always take care of ourselves. If we are feeling that we have some headache and we are feeling some running nose, we should immediately take some preventive measures in home, like we should start taking steam, and we should take we can take hal- hal- healthy milk, yellow golden milk, and
Hmm.
other kadhas we can make in home. And we should you know uh, remain positive that we will overcome if we
Yeah.
get from infected with this infection. Any diseases affect more when we are very negative and we are thinking that it will affect
Yeah.
us. Psychology play a very role to a very important role for overcoming any infection and to treat any diseases. We are self-treater for any disease. So first preventive measure, wear mask properly. I have seen the peoples
Yeah.
around parks and other those things, they wear masks, but they are wearing just to avoid the police and all these things.
Yeah. Police
They are
challan. Yeah.
yes, they are taking mask, they are wearing mask, but their mask is hanging over there and they are not wearing on the mouth as well as nose. So they are opening the path where the virus
Yeah.
got uh, definitely will enter into their tracks. And
Yeah.
before entering, if we are avoiding these entries, we are closing these entries, definitely we will not get infection because virus cannot enter in our skin. Till date,
Hmm.
we don't have data that this will be entered by the skin. Therefore, the first preventive measure is the mask. We should wear properly mask, and we should take good quality mask. These are the measures one should take care.
Thank you, ma'am. And ma'am, like you said, staying positive. But when you were, having COVID or something, at that point of time, any person mental stress is like, some people are watching news and somehow, these journalists make up the news and made like so fuss about it. Like you'll get this and this. And at that point of time, a normal, genuine human like me feels like, okay, now what, I'm gonna die or something. So it's like, how could someone able to manage their stress and anxiety at the same moment?
Actually, yes, when we are sick, we are very, we are psychologically sick at that point.
Yeah,
We can stay positive by taking ourselves a positive. Like news are always spread there. That there are
mm-hmm.
several news. All channels are full with the negative news, but the social responsibility of families started from this point. If
Yeah,
someone is sick in the family members should support and provide love and care to the person who is getting infection and who is sick. And at that point, he and she require your moral support. Family should provide
yeah,
a moral support, and person should stay positive, because if we provide the positive environment in a home, the person will definitely will have positive atmosphere and will overcome the infection. Definitely he will and she will overcome this infection easily.
yes. I get it. Like being positive is something we have to make up in our mind. And this is, I personally believe it's a person will, how he'll able to deal with the situation. So it's like that. And ma'am, like there are like two famous vaccines, the COVID shield and the co-vaccine. So will they be effective against the third wave of COVID?
Actually, I don't want to talk about that these points. These two vaccines were made for the first wave basically, but the variant of virus, because virus has several mutations.
Yeah, exactly.
There is it has muted. Virus has muted that in different countries. In our India, at the initial stage, we found around 11 to 12 virus variants in initial months,
Yeah,
and after several months it got new variants of the virus. So
yeah,
yes, vaccine is solution for the virus, but I can't comment on the third variant, that how they will be effective for it, because their companies are trying their best, and they are doing their best to provide, to help the society. But virus is so miscellaneous that we can't predict the behavior of virus, and we can't predict how will it affect our society, and what will be the vulnerability related to this virus. Therefore, we can't say that the first and second variant dose will be effective for this Delta variant or third wave.
And ma'am, there is this rapid test like people used to do it. So how reliable are they? Because I have seen certain cases in which the first rapid case states like you are negative, but when the actual COVID test it happens you are positive. And by the time some people are like I am negative, so they'll just roam around and spread the virus. So how actually reliable are the rapid test are?
You know, test rapid test and other related tests to the COVID are. I don't want to comment on these also, because you know when the numbers of virus uh, increased a very high speed at a very high speed, their companies were in hurry to make those COVID test kits,
Hmm.
and there are new startups and setups have been started, and new production has been started without any proper any proper basement and any proper knowledge. And so we don't to check that whether those companies are following the guidelines and other those things. So these kits were produced at a large scale because demands were high, and we have to overcome the test which every states and other um, states were under pressure that we should
Hmm.
provide
Hmm.
test kits and other elements essential for the COVID test and other those things.
Yes.
So the
Okay.
test kits were prepared at a high speed, and reliability were doubtful. Therefore,
Yeah.
sometimes we get negative test even we are positive with the COVID. And different companies have their different scenarios. When we have mass production, then definitely if someone is not taking care of guidelines and other those things, the test kit may not contain the essential elements present essential element required to test the positive or negative presence of the virus. Therefore, these test kits were not so much reliable to identify the virus.
Okay, ma'am. And when the vaccination got in the market, so there were like this thing that the pregnant woman or the breastfeeding woman can't be vaccinated. So is it a myth or like it is like still going like pregnant women or the breastfeeding women can't be vaccinated?
Actually, at the starting, in the starting, were we were not having so much data of vaccinated people and other those things, because vaccine was new in the market,
Yeah.
and we were not having so much data in support that vaccine is going well. So, for pregnant women and other vulnerable peoples were avoided, because we can't say that in case of pregnant women, if we are trying on them, or we are taking risk for two lives. Therefore, it was advisable to avoid pregnant women for vaccination, because we don't have data, we don't have so much strong clinical trial data at that time. Therefore, pregnant women and the vulnerable peoples were avoided for vaccination. There was
Okay.
not a
And
myth, it was a truth.
truth, exactly. So the myth is all broken up. Like
Yes.
pregnant women and breastfeeding women can't be vaccinated. And ma'am, like what exactly the side effects should we anticipate with the COVID vaccine, especially children? Like even if like well I got vaccinated, obviously there were certain side effects like we were having, like, some people are fainted and you were having body pain. So like when there will be a children vaccine, so will there be side effects for children? Because I believe
No,
every medicine have side effect.
no, actually, this was not a side effect. Actually, this was our body response. If we are giving our body something new thing, always our
Mm-hmm.
body will respond against it or
Hmm.
in favor of it. So it was just a body response that we are getting from our body. Like
Hmm.
in case of vaccine, we there are four types of vaccine in the market for COVID, uh,
Hmm. Hmm.
and these vaccines when they entered in our body, they will they will alter our immune system. Therefore, this was our body response. Then that if someone get vaccine, it will definitely will have fever. This is only just a body response, and after vaccination, there will be some changes. Like we will feel this is our just a psychology.
Hmm.
Yes, after, because we don't have so much data regarding these vaccine, how they will affect after, what effect we have after 4 year and 3 years. We therefore we can't say clearly about the side effects. But yes, when we get vaccine, this is just our body response. We are getting from our body that something has been given to us, and
Yeah.
our body will respond against or against the virus. So this is just a preparation of our body towards avoiding the infection from the virus.
Okay. And ma'am, as you know, we all know, like, the situation now is kind of stable, and like the government has announced that the schools are going to be opening schools and the colleges are opening soon. So I certainly believe the college student is somehow grown up above 18. He or she can maybe handle, they have certain kind of IQ that, being able to, but at the same time, the children which are in the age group of from, uh, age group like 5 to like 15. So they, even though you have like parents do, tell their children wear the mask and everything, but somehow unintentionally they happen to, just remove the mask. So like, what is your, thought on that? Like, is it like safe to go back to, the old self, opening the schools, having the education? Like, the education is still now, but it's virtual, but then we'll, shifting back to a traditional old. So like, is it safe?
At some point, it is not safer to go school back, because in schools, children will not so much vigil to have preventive measures. uh,
Hmm.
as the little children don't take care of their mask, and they will remove it, because at home or under under any invigilator, like mothers and fathers,
Yeah.
they will, they will always make them to wear mask properly. But in school, there may be a limited staff, because
Yeah.
whole staff will not be permitted to get back to
Mm-hmm.
school. And I think whole classroom will not be allowed to go back to schools. Always there will be a risk to get children back to the school, because they are not so aware, they are so little, because they always behave like that. Nobody is going to ask them what they have done. They will always touch here and there, they will always rub their hands here and there, they always
Hmm.
will not take care of things they should take care.
Yes,
And
ma'am.
and school authority cannot provide, take child care,
Yeah.
child, each and every child, a close eye that what the children are doing. And sanitization, 1 hour sanitization of classroom and desk and all other those things will not be possible for the school authority. So it is totally now comes now totally a burden of taking care of themselves comes on the children, and children are not so mature to take this burden on them. yes, mature childs are aware that this virus may affect. The children are also aware, but
Hmm.
they will, I think, they will not be so smart for avoiding the infection.
Yeah.
It will be very hard for the school authority to maintain health and hygiene for each and every child. Each and
Hmm.
every child will not take care of itself. It is not necessary that each and every child is so understand, so so mature to understand all the preventive measures. And yes, it will be definitely hard for the children as well as parents will remain always in under pressure that our children will get infection if we are sending them to school. And school authority will always have burden on them from the parent side as well as from own side, that how we can prevent this infection and the spreading of those infections. Though the cases of childs are so less, and we don't have so much data against child that they are the vectors for this virus, because
Yeah.
they are not so they are we don't have data from world as well as from India that children are born to this virus, because the first wave of virus, we don't have any, I think, case for infection in children. And in second wave we also have no certain data for children that children got infection. In third case we are assuming that now the environment is full of virus infection, therefore it may. And in our second group age, first and
Yeah.
second group age, we get vaccinated and we are now immune to the infection, but children
Hmm.
don't get any vaccine and other things, and virus is present now in atmosphere. So yes, this may affect child, and it is very hard and burden on the children as well as on parents and school authority to maintain all health and hygiene during this school
Um, thank you, ma'am. So, like I said, I'm Pooja Patil and I'm the project lead. Like we said before, we want to create an awareness as possible to reduce the stigma which runs around different diseases through our various activities and initiatives. We believe that children are the future of generation and the symbol of our health. Today, we sensitized widely about COVID-19 and the third wave, which was the need of the hour topic. I hope from today's session, it was a real eye opener for many of our viewers and an alert warning about the prevalence of third wave and the beginning of it in our country. I was amazed by all the guidelines which you gave us, ma'am, and the clarity with which you made us understand. Thank you so much for joining us, Dr. Amita Kumari, ma'am.
Thank you so much, Pooja.
Uh,
Thank you so much.
Thank you so much, ma'am. And I must say, this was one of the most insightful session of the evening. And every good thing comes to an end. And this was like one undoubtedly my most enlightening seminar that I have attended. And thank you so much, ma'am, for taking your time and explaining us everything so thoroughly. And now I would like to invite Minrali for the vote of thanks.
Thank you, Gunjan. As all good things come to an end in life, so is this session. On behalf of sarkarischool.in, I, Mrinali, take this opportunity to propose vote of thanks to all those who have directly and indirectly contributed to this wonderful session. At the outset, I thank our distinguished speaker and women scientist, Dr. Amita Kumari. We are really enlightened with your knowledge and presence, ma'am. We are also thankful to our honorable founder, Mr. Abhishek Ranjan, for his motivation and enthusiastic support we received at every step and still receiving. Thank you so much, sir. A special thanks to our wonderful audience who are showing keen interest and patiently listening to us. I hope you all enjoyed this session and gathered enough information about the disease which ma'am told us. Last but not the least, I would like to thank my complete team of Project Arogya who always helped and encouraged me and make this event successful. Thank you everyone and stay safe.
Thank you so much, ma'am.
Thank you so much. Thank you, everyone. Thank you, Abhishek, Ranjanji, and all the team. You are doing very good job, and I think this message of this effect will always be good for the children and in favor of society. Thank you so much.